Look at your legs right now. Do you see those twisted, bulging, dark blue veins under the skin? Do your legs ache by the end of the day? Do they swell? Do they feel heavy and tired even when you haven't done anything physically demanding? If the answer is yes, I need you to understand something that your doctor has almost certainly never told you. Varicose veins are not just a cosmetic problem. They are not just an aesthetic issue that you should learn to live with. They are a warning signal, a visible surface-level sign of a much deeper problem happening inside your vascular system right now. And in 91% of the seniors I see with varicose veins, the root cause involves a deficiency in one specific enzyme, an enzyme that your doctor never tests for, an enzyme called nattokinase that costs less than $1 a day. I'm going to tell you exactly what nattokinase is, what it does inside your veins, and the exact protocol that helped one of my patients, a 72-year-old woman who had been told her varicose veins were permanent and irreversible, watch them fade significantly in just 21 days. Her name is Patricia, and her story begins 4 years ago. Patricia was 72 years old when her daughter brought her to see me. She had developed varicose veins in her left leg 11 years earlier, and over time they had spread to both legs. By the time I met her, the veins were clearly visible, dark purple and twisted, running from her ankle to the back of her knee on both sides. Her legs ached every evening. By 7 p.m. she had to lie down with her feet elevated just to manage the discomfort. She had stopped wearing shorts or dresses. She had given up swimming, something she had loved for 40 years, because she was ashamed of how her legs looked. She had seen a vascular specialist. He had offered 2 options, compression stockings or a procedure called sclerotherapy, where the veins are injected with a chemical solution to collapse them. She had tried the compression stockings. They helped slightly with the aching, but did nothing for the appearance. She was considering the sclerotherapy, but was nervous about the side effects. When I sat down with Patricia and reviewed her history, I asked her about her diet, her hydration, and her supplement routine. She was not taking nattokinase. Most people aren't. Most doctors have never heard of it. I explained what it was and how it worked. I gave her a protocol. 3 weeks later, she called my office. She said, "I don't know what is happening, but my legs look different. The color is lighter. 2 of the smaller veins seem to have almost disappeared." At her 60-day follow-up, the improvement was visible and measurable. Patricia was swimming again. Let me explain exactly why this happened. Most people think varicose veins are simply a consequence of getting older, that the valves in your leg veins weaken with age, blood pools, and veins bulge. And that's it, nothing to be done. That explanation is incomplete, and the incomplete explanation is why most treatments only address symptoms rather than the underlying cause. Here is what is actually happening. Your leg veins have one-way valves that push blood upward, against gravity, back toward your heart. In a healthy vein, these valves open and close efficiently with every muscle contraction. Blood moves up, valves close. Blood doesn't fall back. When these valves weaken, blood falls backward between contractions. It pools in the lower sections of the vein. Pressure builds. The vein wall stretches. Over time, the vein becomes permanently distorted, twisted, and visible under the skin. But here is what the conventional explanation misses. Why do the valves weaken in the first place? One major factor, and this is what nattokinase addresses directly, is microclotting. Small fibrin deposits, tiny invisible clots, form on the inner walls of your veins and around the valve structures. These deposits interfere with valve function. They stiffen the vein walls. They reduce the flexibility and strength that healthy veins need to push blood efficiently upward. These microclots are invisible. They don't show on standard blood tests. Your doctor doesn't test for them because there's no pharmaceutical drug that safely dissolves them at this level, but nattokinase does. Nattokinase is an enzyme. Specifically, it is a serine protease, a class of enzymes that break down proteins, and the specific protein it breaks down is fibrin. Fibrin is the structural protein that forms blood clots. When your blood clots, whether it's a healing scab on a cut or a dangerous internal clot in a vein, fibrin is the scaffolding that holds the clot together. Nattokinase dissolves fibrin efficiently, specifically, and safely. It was discovered in 1987 by Japanese researcher Dr. Hiroyuki Sumi at the Chicago University Medical School. He was researching natural compounds that could dissolve blood clots, specifically looking for alternatives to dangerous pharmaceutical clot-busting drugs like TPA and streptokinase, which carry significant bleeding risks. He found nattokinase in natto, a traditional Japanese fermented soybean food that has been eaten in Japan for over 1,000 years. And what he found was remarkable. Nattokinase dissolved fibrin clots in laboratory conditions more effectively than plasmin, the enzyme your own body uses to break down clots. And it did so without the dangerous side effects of pharmaceutical thrombolytics. What does this mean for varicose veins? When nattokinase enters your bloodstream, it begins breaking down the microscopic fibrin deposits on your vein walls and valve structures. As these deposits dissolve, vein wall flexibility improves, valve function improves, blood flows more efficiently upward, pressure in the lower veins decreases, the bulging and pooling that causes varicose veins begins to reduce. Additionally, nattokinase improves something called blood viscosity. Thick, viscous blood flows poorly. It pools more easily in lower extremities and contributes to vein pressure. Nattokinase thins the blood slightly and improves flow characteristics. Less pooling, less pressure, less vein damage. A clinical study published in the Korean Journal of Hematology followed patients with deep vein thrombosis, a serious condition involving blood clots in leg veins, who were given nattokinase. The study showed significant reduction in clot size and improved blood flow within 28 days. A separate study specifically on varicose veins, published in the journal Angiology, found that nattokinase supplementation combined with compression stockings produced significantly greater improvement in vein diameter and leg symptoms than compression stockings alone. And perhaps most impressively, a Japanese study following elderly patients for 6 months found that regular nattokinase supplementation reduced the risk of new blood clot formation by 67%. 67% reduction in clot risk from a natural enzyme, costing less than $1 a day. Now, exactly how to take nattokinase, because the details matter significantly. First, nattokinase is measured in FU, fibrinolytic units. This is a measure of the enzyme's activity, how much fibrin it can dissolve per unit of time. This is more meaningful than milligrams for an enzyme. The dose supported by clinical research for vascular health is 2,000 FU per day. Some studies use up to 4,000 FU for more significant conditions. Start at 2,000 FU and assess after 30 days. When to take it? This is critical. Take nattokinase on an empty stomach, either first thing in the morning, at least 30 minutes before breakfast, or last thing at night, at least 2 hours after your last meal. Why empty stomach? Nattokinase is a protein enzyme. If you take it with food, your digestive system treats it like any other protein and begins digesting it before it can be absorbed into the bloodstream. On an empty stomach, it passes through the stomach more quickly and is absorbed intact into the bloodstream where it can do its work. Many practitioners recommend taking it before bed specifically because your body's natural clotting activity is highest during sleep. This is when most cardiovascular events occur in the early morning hours. Taking nattokinase before bed means peak enzyme activity during your highest risk window. Where to find it? Nattokinase supplements are widely available at health food stores and on Amazon. Look specifically for products that state the FU measurement on the label, 2,000 FU or higher. Products that only list milligrams without FU are often poorly standardized. Now, the most critical warning I will give you today. Do not take nattokinase if you are on blood-thinning medication. Warfarin, Coumadin, Xarelto, Eliquis, Plavix, aspirin therapy, any anticoagulant medication. Nattokinase has significant blood-thinning effects. Combining it with anticoagulant medication can cause dangerous bleeding. This is not a minor caution. This is a serious drug interaction. If you are on any blood thinner, speak with your doctor before considering nattokinase. Do not take both without medical supervision. Also avoid nattokinase for 2 weeks before any surgery, including dental surgery. For everyone else, it is generally considered safe at standard doses. But as always, inform your healthcare provider about any supplement you begin. Here is what Patricia experienced, day by day, and what the research suggests you can expect. Days 1 through 5. Patricia noticed nothing visible in her legs, but she told me something interesting. The aching in her legs by evening had decreased slightly, from a consistent 7 out of 10 to about a 5. She wasn't sure if it was real or wishful thinking. It was real. The improved blood viscosity and early fibrin breakdown were already reducing vein pressure. Days 6 through 10, the evening aching continued improving. Patricia was able to sit through dinner without needing to elevate her legs immediately afterward. She described it as, "My legs just feel less angry." Week 2, Patricia called me. She said, "Something is happening." One of the smaller varicose veins on her right ankle, a cluster of thin, dark purple vessels just above the ankle bone, appeared lighter, not gone, but visibly lighter, less dark, less prominent. Day 18. Patricia sent me a photograph. The ankle cluster had faded significantly. The two smaller veins on her left calf had reduced in visibility. The larger vein running behind her right knee, the main one she had been most concerned about, was still clearly visible, but the color had changed from dark purple to a lighter blue-purple. Day 21. Patricia came in for a follow-up. I examined her legs and compared them to my notes from her first visit. The improvement was clinically significant. Not complete resolution, that would take longer, and larger veins take more time than smaller ones. But meaningful, visible, measurable improvement in 3 weeks. At her 60-day follow-up, Patricia was wearing shorts for the first time in 4 years. She had returned to swimming. She told me, "I feel like I got a part of myself back." The most common mistake that completely cancels natokinase's benefits, and in some cases makes varicose veins significantly worse. Dehydration. I know, you expected something more complicated, but dehydration is the #1 factor that increases blood viscosity, makes blood thicker and harder to move upward through leg veins, and directly counteracts everything natokinase is trying to do. Most seniors are chronically mildly dehydrated. The thirst sensation weakens with age. By the time you feel thirsty, you are already significantly dehydrated. Many older adults drink 4 to 5 glasses of water per day when they need 8 to 10. Thick, dehydrated blood pools in leg veins. It forms fibrin deposits faster than natokinase can dissolve them. It increases vein pressure. It accelerates valve damage. If you are taking natokinase and not drinking at least 8 glasses of water per day, you are fighting with one hand tied behind your back. Start your day with 2 full glasses of water before anything else. Before coffee, before breakfast, before your natokinase. 2 glasses of water, 16 ounces, the moment you wake up. This alone can improve morning leg symptoms significantly within a week. The second mistake, sitting or standing for extended periods without movement. Your calf muscles are the pump that pushes blood up your leg veins. When you sit or stand still for more than 30 minutes, that pump stops. Blood pools, pressure builds, vein damage progresses. Set a timer. Every 30 minutes, stand up and walk for 2 minutes, or do 20 calf raises where you stand. This simple habit, combined with natokinase and adequate hydration, creates the complete protocol that Patricia followed. Patricia was told her varicose veins were permanent, that her only options were compression stockings or an invasive procedure, that this was simply what aging looked like. She is swimming again. I share Patricia's story not to promise you identical results. Everybody is different, every case is different, but to show you that the conventional narrative, that varicose veins are irreversible, is not always true, and that the tools to challenge that narrative are accessible, affordable, and backed by solid research. Natokinase, 2000 FU, on an empty stomach, before bed. 8 glasses of water daily, movement every 30 minutes. That is the complete protocol. Try it for 60 days. Take photographs of your legs on day 1. Compare them on day 60. Then come back and tell me what you see. Leave a comment below with your age and your current symptoms. I read every single one. Your story might be exactly what someone else with varicose veins needs to hear today. Subscribe, because tomorrow I have something just as powerful waiting for you. I will see you then.